Sinusitis is extremely common in this area. Many patients develop colds followed by sinus infections. The infections are characterized by blockage, discharge, which is often purulent, basically feeling fatigue, pressure, crummy. They just don't feel well. They find that many times the medications just haven't really led to the kind of outcome that they want in terms of complete resolution of the problem, and therefore they turn to surgery. It's nice to be able to offer the more conservative endoscopic type of procedures with state-of-the-art equipment in the community, which will allow them to get a more permanent resolution of their problem. When a patient does require surgery and medication and medical therapy has failed, we often find it very useful to perform endoscopic sinus surgery, which is a surgery which we perform here at Lowell General with telescopes, which gives us tremendous view of the sinus cavities. In certain cases, we're able to use a CT-guided system called the Brain Lab system, which Lowell General has had for us over the past several years, which allows us to have a GPS system which guides us through the sinus cavities. In addition, recently there has been balloon catheterization, or sinus balloon sinuplasty, which allows us to place a small balloon into a sinus passageway, gently inflate it to promote better drainage and discharge, and overall allow the sinuses to heal with less aggressive type of intervention.
The benefit is that it's a very thin catheter which we thread into the openings into the sinuses, which frequently are the narrowest point. And by inflating a balloon, we expand the opening of the sinus. Like this, you can see the balloon on this catheter, and by inflating this balloon, we will open the opening so that drainage can take place without having to do any significant cutting, or will minimize the bleeding.
As far as what to expect after surgery, if you do opt for this type of intervention, it's much less painful, much less bleeding and bruising than in the old days, and it continues to get even more comfortable for patients as we evolve new techniques and instrumentation, which we're now using here at Lowell General. Typically, in the past, we felt compelled to take our patients, especially with more complex disease, into Boston at Mass Eye, where we would perform much of the intervention. Now we're able to do it here in the community at Lowell General Hospital because of the state-of-the-art technique and instrumentation which is now available to us. Many patients find this to be a tremendous convenience and relief in not having to really travel into Boston. As far as insurance coverage, it's actually easier because the patients don't have to work through their insurance companies to get the permission to go to Boston, so to speak. They're able to have it right here in the community, which seems to be very easy on everybody.